This is going to be one of those primary changes coming out of the coronavirus pandemic globally. And I think it's perhaps one of the most visible on the surface, but it's also one of the deepest, and I would also say one of the most overdue in healthcare. The immediate situation that many people saw at the start of the year, the lack of being able to meet people face to face, has been a big driver in one of the primary changes, which has been online consultations, video consultations. The technology is all there, but it's only really now just had to be implemented because it had to be in healthcare. Actually starting to look at how resources are better utilised, shared across all levels of care, and that's a very visible example from a video consultation at the front end, but right back to much more complex areas like supply chains and the sharing of resources to be able to have a better oversight of utilisation. These will be really significant changes that will revolutionise healthcare in the years ahead. There is a real opportunity for Bermuda to harness digital health and health tech as it moves forward and improves the healthcare system in years to come.
So maybe some new job categories coming up, some new opportunities which are needed. I mean, nursing seems to be struggling generally worldwide.
Globally, we are significantly short of trained medical staff, nursing, doctors, specialists, and this has been a major issue. And bring in a global pandemic that has frankly worn out a large section of the healthcare workforce, put them at the front line and at risk themselves, but also really highlighted the shortages that we already have, triggered thinking about how we have a much more agile workforce that works differently. One of the key focuses around this is how we start to think about roles in terms of tasks rather than job titles. And there are some really good examples where this was through acute staff shortages at the height of the crisis really forced upon healthcare providers around the world. You can suddenly see that other people are quite capable of undertaking jobs, for example, that don't require a medical degree to do them. Why put that on the doctor's shoulders to do? You could free their time up to do something that they themselves have to do and provide extra help for those other tasks.
What is your view on how Bermuda has handled this?
As an outsider looking on who's really seen what's happening around the world, Bermuda has handled coronavirus very well, and that needs to be recognised, and it needs to be recognised internationally. The process and the organisation that's been put in place is excellent, and many jurisdictions could actually learn lessons from how Bermuda has handled this.